Hey guys, this is Greg with Medical Muscle. And in this video, I want to talk about fourth year electives. I think this is kind of a scary situation for a lot of students. They kind of feel left in the dark and they have to kind of figure it out on their own, which is tough because there's some really important things that you don't want to miss. So what I want to share with you guys is what I did, what really was a good decision, and so that I could set myself up for interviews and graduate with no issues. Okay, so let's get started. So you have to have 80 weeks of rotations between year 3 and 4 total. So during those 80 weeks, you obviously have your 5 core rotations: psych, OBGYN, peds, surgery, and IM during your 3rd year. And on top of that, you have to have family medicine, a sub-I in one of those rotations, and a medicine rotation. Those are the requirements. I'll talk about the medicine rotation later. And then on top of all those, you just fill in the extra weeks that you don't have with electives, right? For some people, during their 3rd year with their core rotations, they may have family medicine, which is great. Then you don't have to knock that out as an elective. I didn't have that option. I had to take it as a 4th year. And the downside is there's only one site for us. So that's an important rotation to book early because I didn't want any reason why I wasn't going to graduate on time. Okay. So for timeline, I basically started rotations the second I was done with step 2. Okay. So that was late August. I started my first rotation. So how to create priority in your schedule. I think the most important rotations are going to be ones that are basically audition rotations for the specialty that you want to go into. Those are the most important ones. Usually September, October, and November are like the best months because most programs are still giving interviews during that time. Maybe even as late as December. Those are good months to book those kind of rotations. I would definitely say September, October, November are the most ideal. If you wait too late, definitely like in January, that's maybe too late to book these kind of electives, okay? The ones that are in the specialty that you want to go into. Now, it's really crucial for you to pick rotation sites that have electives for the specialty that you want, and that also have a residency program in the specialty that you want to go into. That is huge, okay? I'm going to repeat that. You want to do electives in September, October, November, even as late as December. You want to do electives in hospitals that SGU allows you to rotate at, that have a residency in the specialty that you want to go into. So say if you want to go into internal medicine, okay, you want to look for hospitals that have internal medicine rotations, right? But that also have an internal medicine residency, okay? And you want to do different hospitals, September, October, November. That would be ideal, right? Ideal. Because you're basically doing an interview with these programs without having to go through the whole selection process, right? You're basically putting yourself out there. They get to meet you. They get to see you in action, and it allows you to stand out as an applicant, okay? So say if your step 2 score wasn't great, this gives you a huge advantage because they actually get to see you in person. It allows you to stand out from the crowd of all these other applicants that you may look just like, okay? And I'm gonna tell you, I got an interview from one of these situations where I had gone to one of these sites. I did a rotation there. I made sure to introduce myself to the director, and sure enough, I got an interview. So it was really helpful, okay? How do you find these rotation sites? Go on the SGU website. You're gonna go onto the clinical page. You can see all the hospitals that SGU has contracts with, and you can see what rotations these hospitals offer. You should also be looking, do they have a residency in the specialty that you want to go into? That's very important, okay? I don't think it's super important that you do September, October, and November, all 3 months in different hospitals of that specialty with a residency in that program. That would be ideal, but it doesn't have to be like that. It might, if you can only fit one or two, then so be it, right? But if you can fit all three maybe in December, then that gives you a huge advantage, okay? I'm just gonna be honest. Okay, now, scheduling these things. You have to email the programs. And if they don't get back to you, then I think it's really important on you to keep reaching out, okay? Through email, through phone call, contact them. Sometimes your email gets buried in all their stuff and then you gotta get forgotten. So you wanna make sure to reach out to these places early. I would say January is a perfect time to start and just trying to book dates. The downside is a lot of these programs don't start and end at like ideal spots, right? Some of them start mid month, some start in the beginning of the month, so you might not be able to push all of these back to back. You do have to remember you have a maximum of 20 weeks of bridge time, right? And that includes like any vacation time you had during your 3, your time off for step 2. So you don't want to go over the 20 weeks, but inevitably you may have some breaks. I did. I had 3 1-week breaks, okay, in my schedule. It was just the way it went, which was fine. It was nice to have a break, but it kind of freaked me out a little bit because I wanted these things booked back to back. It just doesn't happen sometimes, okay? And you have to be flexible with that. You may have to change things around. So there's a lot of calling people back, trying to fit everything in nice and smoothly. Okay, now for me, family medicine was difficult. In New Jersey, again, it was hard to get a site in New Jersey. So that was my second priority. So I booked that in January. I'm in that currently. I booked it in January because it was kind of out of that like important month range where I'm doing my interview rotations. So that's when I booked that one. Now here's like a weird side note. You kind of want to create an easier block for yourself, right? If you can create a way where you have an easier schedule during November, December, it would help you because you're gonna have a lot of interviews during that time. For me, I had 2 interviews in November and I had 3 in December. So you really have to like figure out if you can do that. You may not be able to, but it's helpful. Some of these programs are very strict. They don't allow you to take off more than 2 days for interviews. That's just the way it goes. But interviews are really important. And, if you have the ability to make up anything, or if you're in a rotation that's fully online or has a flexible schedule, that's ideal. Okay. But that may not work for everybody. Now for the sub-Is, obviously that should be easy. Your sub-I should be in the specialty that you want to go into. And you'll be doing those in the early first 3 months. If family medicine is actually what you want to go into, then I would make sure to get that number 1, right? That makes sense. Maybe a couple different family medicine rotations. You have to do a rotation in a medicine elective, and that's pretty easy. You can look at the list. SGU gives you a big list of what rotations count for that. I did endocrine, counted for that. I did healthcare leadership, that also counted. You can do rheumatology, infectious disease. There's a huge list. So those aren't too hard to do. And then obviously just fill your schedule with electives that are kind of like, similar to the specialty that you want to go into. So say if it is internal medicine, doing endocrine, doing infectious disease, and doing rheumatology, those are all kind of like in the internal medicine realm. So it's helpful for your skill set, right? Other than just doing straight internal medicine hospital floors. But definitely you're gonna have to call early. Start now, start in January. Make sure to set up the electives that you want in the specialty that you want for your first few rotations. Be conscious of the gaps that you have. Don't go over those 20 weeks. Try to make it easier on yourself during interview times, so November, December. If you can't, that's what you got to do. Make sure to get the requirements in. And that's about it, guys. So if you like this video, please like and subscribe to this video and stick around because I got a lot of good content coming up in the future.